New Oakland was founded in the early 1990s by Dr. Ishmael Sendy, a state of Michigan board-certified child psychiatrist who recognized that the state-run mental health system was seriously deficient.
Dr. Sendy's care goal in terms of creating an environment at New Oakland was to provide much warmer, friendlier environment, much more therapeutic and inviting than what you typically get at an inpatient facility.
He saw that kids do better when they're home, and he had a natural intuition about families and children, and you could just see it in his work. And I think that he knew a traditional hospital, it's very cold and sterile, and it's not warm and welcoming. And I think he knew there needed to be something different, and he created that here. David? Hi. Hey, come on in. A lot of times when they come here, they feel like they've tried everything. They've exhausted every avenue, and sometimes they just want to say, here, help, take this child from me, fix this, we've done everything.
Just, he's been irritable all the time, and we've been trying to address it at home, but, he's not really responding, so we've heard maybe, this place is somewhere that can help us out, so.
I don't know why I had to come here. I mean, things aren't that bad at home. I think that my dad's just overreacting.
Just listening to them, validating their feelings, and I can see that you've tried everything. I think if we can form an alliance with the parents in that first session, that goes a long way to getting them on board to help us. And then also letting them know they're a change agent for their child.
I think as parents and as children, we have to recognize this as a two-way street. Communication is a two-way street, getting better is a two-way street, and really just working towards improved mental health involves and requires a two-way street for communication between parents and kids.
David Harris is a psychiatrist at New Oakland, and after reviewing the intake assessment, it's the psychiatrist's role to make an informed diagnosis.
What I will do is typically see the parents first by themselves. I will see the child by themselves, and then I'll see them together as a unit. Parents see things differently from the child, and the child sees things differently from the parent. So if you have them in there at the same time, often the truth is disputable. But what we're looking for is the reality of each individual in the family.
With the intake process, we're able to talk to the family, we're able to look at all of the clinicians we have and see which clinician would best suit this family's needs. We're not there to judge anyone, we're just there to help them to get the best course of treatment.
Okay, so she's working hard to find a job then. Okay.
The face-to-face program is unique to New Oakland. It is Michigan's only licensed, non-hospital-based, partial hospital day treatment program. This session in our Livonia location is age-specific for preteens. All face-to-face sessions from infants through geriatrics are grouped by age.
We always put children in their age-appropriate group or their peer-appropriate group. We have children's groups, we have preteen group, and we have teen group. We also have adult groups, which we keep totally separate from any of our children. In many facilities, they have the teenagers with the little children, and it really doesn't make a good therapeutic milieu. We think this is the key to our face-to-face program.
We always want kids to be in their natural environment. They should be at school. They come here when they're in crisis. It's important for us to work with the schools, the teachers, with the social workers, so we can, number one, understand their perspectives. They're able to tell us the problems that are going on day to day at the school. And then also we want to make sure that the children don't get very behind in their schoolwork. We're actually a partial hospital program, meaning that we're like a hospital in the sense that we provide very intensive services. However, we're not like a hospital in the sense that all the children leave at 3 in the afternoon. So if you have a child that's in crisis and you know you need some intense help, that's really a benefit to a family that their child doesn't have to go inpatient.
One of the difficulties in receiving treatment in an inpatient setting versus an outpatient setting like New Oakland is you're pulling a child away from his family, and you're treating this child and his issues sort of in a vacuum. With kids nowadays, many of their issues are social and interfamily based. So unless you're working with the entire family in a facility like New Oakland, you might not receive sort of that family first mentality that you won't get at an inpatient facility.
So let's sum up the face-to-face difference. It's non-hospital and therefore warmer and more nurturing. Smaller, age-appropriate groups offer greater one-on-one contact, content, and supervision. The length of stay is tailored to the individual, usually 5 to 7 days, but potentially 10 days. And with transportation provided, everyone gets to go home at the end of the day. The path to wellness begins with an accurate diagnosis, and in children and teens in particular, this isn't always easy to do.
Some psychiatric illnesses may masquerade as one illness or another. A lot of the symptoms overlap. And during the evaluation, a lot of times we have to be careful to ascertain the correct information, both from the patient as well as collateral sources.
We have psychologists, we have testing psychologists, we have social workers, we have what we call milieu. These are group therapists to see the child, and of course the doctor and a nurse. So I really think this multidisciplinary approach is our secret here at New Oakland.
A lot of these kids come in and they've never had an adult say to them, "What do you think?" Or "What do you think would be different?" Or "What would make things better?" That they're an active participant, that we want to hear from them. We're going to call them out when we see things that we think they can improve on, but we're also going to respect them and listen to them and validate what they're feeling.
They acknowledge that there's something that needs to be fixed or something needs to be resolved in the family system. They certainly will be receptive to therapy.
Children are always anxious, scared, confused, and really apprehensive to treatment. So what I would tell all kids is don't worry about it. We're on your side. We're here to help. We're going to look at everything and do our best to put you in a position to succeed. A lot of times kids don't feel like mental health providers are there to help them. They're there to control them or hurt them or act as a parent or a boundary setter. We're really there to figure out what's going on and fix the problem.
It's very important to address the patient's perception of an illness. Families and patients have different ideas of what an illness, especially psychiatric illness, might mean. So it's important to get their concept and to help them to work through whatever reservations or misconceptions they may have, especially in the younger patients. Typically, children expect the world to revolve around them. So anything that happens in the world, they feel responsible for. So it's important to let the little kids and the adolescents know that this is not a punishment, that they have not been judged to be somehow defective in coming here, and to help them to normalize and avoid the stigma of mental illness.
No one ever chooses to have a physical or mental disorder, but when we do, our only choice is to use our strength and resources to restore us to good health. So please look at New Oakland as a valuable and important resource. The people here will always give you their best to help you achieve the good health you deserve.